Hello, my name is Shubhayan Sanatani, and I'm a guest reporter on Heart Rhythm TV, coming to you live from Edmonton, Alberta, in Canada, for the 5th annual Hearts and Rhythm Organization meeting, or HiRO. HiRO was started many years ago, and our first guest is going to tell us a bit about that history. And it's a collection of people who are dedicated to the prevention of sudden cardiac death. Researchers, physicians, genetic counselors, nurses, and importantly, families and patients are part of this national collective. So, with me this morning, our first guest and the founder of HiRO, the man who needs no introduction, Dr. Andrew Krahn, our current Heart Rhythm Society president. Welcome, Andrew.
Hey, good morning, Shu.
Well, thanks for joining me on this special episode of Heart Rhythm TV. And I wonder if you could just take us back a bit to how HiRO, or Hearts and Rhythm, got started.
Yeah, it's a really good question. I mean, practically speaking, studying rare diseases requires working together to collect experience and understand and treat patients. And we started off with a group of physician researchers, the typical group of people who are research focused. And about 6 years ago, I had this epiphany that we really, to make a difference, we needed to have people involved who were also involved in providing the care, and the patients and families in terms of who received the care, and also helped to set what was important. So that then led to resetting from a small group of physicians to say, who's involved in this network of clinics that we've created across the country? And then how are the patients and their family members involved in both helping us understand what's important, and also how we are serving their needs and also making a difference in terms of the health system. So it's been really rewarding to me that we started off with 4 clinics 20 years ago, and then it was 8, and then it was 12, and now we have 24 clinics across the country. They have varying degrees of sort of organization and sophistication around their cardiogenetics clinics, but they are all committed to participating in HiRO because it's a forum in which all of the constituents are together.
And you've had a tremendous role in shaping the Canadian landscape, really, in inherited heart rhythm conditions. Dozens of publications, trainees, people that have really spread out from Canada and gone all over the world. Tell us some of your highlights of this organization, this network.
Well, so one of the things, for example, is that as a champion in this area, first of all, it wasn't hard to find people who were interested. These were typically clinicians taking an interest, seeing patients at their center. But for this to be sustained, it really needs several things. And one is it needs a group of people who own the problems, own the values of and then that's part of the idea of the creation of the organization is we now have a new generation of people who have formal training, are much smarter than us older folks, and are asking new and different questions about how to improve the system and understand the diseases and prevent sudden death and so on. And so now a good example is our organization is funded by a national peer-reviewed grant. But several of that next generation in their first 5 to 7 years of their career are now attracting funding that is now taking us in new directions. So they're not us as well, it's actually, we want to expand, we're taking a new direction. So when several of those people now embark on things that make us bigger and better, it's just so rewarding because it means that my role is to help and guide and mentor, if you like, but it's really they're the ones who are advancing the field.
It was great this morning sitting at a table with doctors, nurses, patient families, and talking about artificial intelligence and deep learning. Tell us about the next few years in terms of, I know you have a real interest in digital health and AI and the really bringing technology into inherited heart rhythm research and care.
Well, on the one hand, my HRS president hat, if I have that on, one of my big points of emphasis is this whole idea of, EP needs to be leaders in cardiovascular digital health. We need to carry the torch. But with that, we actually, as the clinical service delivery team, we need the digital skills. So some of it is us being familiar with terms like AI and machine learning. The term I learned recently was digital biomarkers. These kinds of concepts. We have a meeting focused on this that's coming up at HRX in September. And that's a skill set problem in the area of inherited conditions. You could argue that one of our biggest challenges is picking up the evidence of disease. And so one of the things that AI and machine learning has the potential to do is provide these kind of screening or case finding tools, and then they can get to experts, quite frankly, like us and our teams, to say, putting this all together with genetic information, clinical diagnostics, and so on, what's going on, and then that gets us ahead of it. I'm sure you've experienced the situation where you meet somebody who's had sort of a near fatal event, and then you find a large number of family members who are preclinical, if you like, and you get ahead of it and you cure their long QT or prevent them from ever having a tragedy with CPVT by that kind of advanced diagnostics. So to me, there's two main elements to this that I think AI and machine learning will help with. One is case finding, because it will ascertain a lot more than we do. And the other is risk prediction, which will help us to know how our therapies can be best delivered.
Fantastic. Congratulations on another great meeting, and really just for generating this very innovative, very collaborative culture in Canada. I think you've really given the nation a tremendous gift, and good luck with the rest of your president's year. I know you keep a full agenda, so thanks for taking the time for this talk.
Can I just add one thing?
Of course.
So this morning at the meeting, although the audience won't be aware of this, but this morning at the meeting, one of the things that we experienced that was really moving was somebody stood up in the audience and said, "I just want to express my gratitude for the fact that we determined the cause of the tragedy in our family because someone interested from HiRO did the work to try to find out what happened, found DNA from 15 years ago, was able to identify a cause, and has now helped us understand in our family and protect our family." And they're grateful for that. And that's what it's all about, right? It's just such a heartwarming feeling to know that right down to the patient level and that family, we've made a difference. And that's why we go to work every morning, right?
Yeah. No, absolutely. That was a very, very great story, very simple message.
Made it all worth it.
Yeah.
Yeah. Okay.
Thanks so much, Andrew.
Okay. Take care.